To Delhi now, which has reported over 5,000 new COVID cases in the past 24 hours, which is up over 33%. If you compare the figures again to the 20th of December, it is over 1,000%. There are 482 COVID patients in hospitals, and Delhi has already now, starting this weekend, have a weekend curfew as well. There will be work from home mandatory for all government offices. And private sector asked to take a call on their own, but not to operate with more than 50% capacity. Buses and metros have, however, been allowed to operate with full capacity. This after NDTV, along with several other organizations, talked about how sort of cutting down on capacity for metro and buses was leading to more problems as there was more crowding and more queues that were actually forming outside these stations. Meher Pandey joins us for the very latest on this story as well. Meher, so, when this report actually came in, Delhi government seems to have taken feedback from people and understood that cutting down capacity of metro and also of buses is not really helping. But at the moment, how significant is this rise in the number of hospitalization? Of course, compared to Delta, this stands at a very low level. But what are doctors saying about this?
Exactly, Sona. So just in the past 4-5 days, the national capital has seen an exponential rise in COVID cases. Just in the last 24 hours, 5,481 new cases, and positivity is now at 8.37%. This is up from just around 2%, which is less than a week ago. So there's been an exponential rise in positivity and the number of cases, which has led to a lot of panic in the national capital. Of course, the change in the guidelines for public transport has been important because many people were complaining that outside metros, the huge lines that were forming, they were not allowing social distancing to actually take place. So it was defeating the purpose of cutting down on capacity of the train itself. So when we actually talk about hospitalization, that's an aspect to really consider as well, because although cases are jumping very significantly, we also need to look at whether hospitals are being able to keep up with this increase. That is how we will know whether we can take care of this third wave that we are currently in. So as of the latest information, 531 COVID patients are currently hospitalized in Delhi, of which around 168 are on oxygen support, and 308 are asymptomatic or mild and without oxygen support. There are 14 patients on ventilator. So that 168 number is significant. It's a significant percentage of the number of people who are hospitalized. It's around 30% of people who are already on oxygen support. So these are called moderate patients. That is what we know about this variant so far. It is leading to milder disease than the Delta variant, but we cannot say it is mild because it is highly transmissible and it is reaching more patients than the Delta variant did and more patients who are vulnerable to severe disease. So we do need to be preparing ourselves for the worst, and the Delhi government is slowly starting to do that as well. Private hospitals have been asked to increase their reserve for COVID beds to 40% of their total bed capacity now. They had initially reduced it in light of the fall in cases and also dengue, chikungunya cases. They had reduced their COVID beds at that time, but now they are scaling up again because we are in the middle of a third wave.
Right. Meher Pandey, thanks so much for joining us at the very latest. In fact, let's give you a wrap of what exactly are the fresh curbs that have been enforced in the national capital. Here's a report.
दिल्ली में सैटरडे और संडे को यानी वीकेंड्स पर अब कर्फ्यू रहेगा। तो गवर्नमेंट ऑफिसेज वर्क फ्रॉम होम मोड पे रहेंगे। बसें और मेट्रो पूरी कैपेसिटी पे चलेंगी।
The weekend curfew in Delhi, announced on a day when the Chief Minister announced that he tested positive for COVID, Arvind Kejriwal says he has mild symptoms. Delhi's current positivity rate is at 8.5%, with daily cases crossing the 5,000 mark. The city's health minister has ruled out the possibility of a lockdown.
दिल्ली में कोई लॉकडाउन नहीं लगाया जा रहा फॉर द टाइम।
संक्रमण दर कितनी दर्ज होगी?
लगभग 8.5% के आसपास।
The news of a weekend curfew means a complete restriction on people's movements and curbs on non-essential activities. It also comes at a time when dozens of doctors across the national capital are testing positive for COVID. 23 doctors in Safdarjung have contracted the virus. At AIIMS, the winter break has been cancelled for medical staff who have been told to return to work immediately. The curbs announced today include weekend curfew on Saturdays and Sundays in Delhi. The night curfew will continue. Buses and metros will function at full capacity. Essential services will continue. Government offices barring essential services will have to return to work from home, and private offices are to function at 50% capacity and have been urged to opt for work from home for all employees. So how will this weekend curfew impact small businesses?
असर पड़ेगा बहुत ज्यादा है, हम क्या करके खाएंगे।
सब पार्टी के नेता है जो मास्क नहीं पहन रहे और सोशल डिस्टेंसिंग नहीं है, लेकिन कर्फ्यू लग रहा है यहाँ।
तो मैडम उनके लिए भी तो कर्फ्यू लगना चाहिए ना, हमारे को गरीब आदमी हम तो मारे जाएंगे।
Delhi saw this coming. First, a public ban on gatherings before festivals, then a yellow alert, and now a weekend curfew announced on a day when the Chief Minister himself has said he has tested positive for COVID. All of this as India witnesses a third wave of COVID. With Sushil Rathi, Shanakshi Chakravarti for NDTV.